The Ministry of Health and Social Services held a commemoration of World AIDS Day at Rundu under the theme, Take the Rights Path. This is a call to action to prioritize and protect human rights to achieve the collective goal of ending AIDS by 2030. Health Minister Kalumbi Shangula highlighted that Namibia's World AIDS Day theme for this year underscores the importance of upholding human rights to ensure integrated and affordable access to health services and social protection for all by 2030.
The Global AIDS Strategy 2021 to 2026, in which Namibia has been an active participant in its development, identified the integration of mental health and psychosocial support within HIV service as a key priority to promote holistic care. This aims to address both mental health needs and physical health in a unified framework, reducing stigma and improving treatment adherence for people living with HIV. We must continue to talk about these matters in order to create awareness and to reduce stigma.
Last year, there were approximately 230,000 people with HIV in Namibia, of which 65% are women. Statistics also shows that HIV prevalence rate among people between the ages of 15 to 49 stands at 9.7%. Nationally, the HIV prevalence rate is higher among women at 12.7% compared to men at 6.6%.
The interventions we are implementing are having notable impacts. According to statistics, 93% of persons living with HIV in Namibia have been tested and know their status. 95% of those who know their status have been initiated on antiretroviral therapy, provided free of charge by the government. And those who are on ARVs, 98% are virally suppressed, meaning they are unable to transmit the infection. Our commitment to mental wellness as part of HIV care focuses on key components, including access to services, reduction of stigma, strengthening support networks, and integrated care. I reaffirm the Ministry and the government's unwavering commitment to ending the HIV/AIDS epidemic as a public health threat by 2030.
To continue the fight against HIV and AIDS, key documents that are part of the ongoing efforts and innovation to strengthen the HIV and TB response were launched. The documents are the 4th edition of the Drug-Resistant TB Pocket Guideline, Mine Health and Safety Standard Operating Procedures, the Mental Health Standard Operating Procedure in HIV and TB Care, Community Mental Health Toolkit, and the Sustainability Roadmap for HIV and AIDS, viral hepatitis, tuberculosis, and malaria.
Despite an increasing body of evidence showing that effective methods of prevention and treatments for common mental health conditions, including depression and anxiety, exist and do not need to be expensive, services for mental health are often not integrated into packages of essential services and care, including HIV. Integrating HIV and mental health services and other interventions with a human-centered approach, including linkages to social protection services for people living with HIV and other vulnerable populations, is of vulnerable importance.
PEPFAR Country Coordinator Shirley Amoros applauded the government's effort in making sure that health services are brought closer to the people. Elizabeth Mwengo, NBC News, Rundu.